Hi, I'm Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health at Sheshadripuram, Bangalore. I'm also the Director and Co-founder of Aveksha, which is a home-based primary care program at PCMH Restore Health. My expertise is in palliative care and geriatric care. We provide home-based services for those who are in need of it. The prevention of coronavirus is by various methods. There is a standard hygiene measures which are followed, and the CDC or the WHO do not recommend just wearing masks, and masks do not prevent transmission of infection, the coronavirus. The other ways of preventing is maintaining hygiene by washing your hands frequently with soap and water or with the alcohol-based hand sanitizer. Do not have close contact with people who are known to have a coronavirus infection or who have a cough and a cold, and avoid touching objects unless and until it is required. Like the virus could be on a handle, could be on a table. So do not touch objects and then touch your face, your eyes or mouth, because that's the way the virus is transmitted from an object to the human beings. And the other things are about maintaining your hydration by drinking enough of fluids, eating lots of fruits and vegetables so that it provides you enough and adequate immunity to fight the infection. Then there are other ways of preventing is by reaching out to your physician if you have a cough and cold and fever, and taking adequate measures so that you get better faster. Restrict your movement if you have fever or cough or a cold. And if somebody has a cough and a cold, you should not cough or sneeze into your hands, but it should always be into a kerchief, not even a kerchief, a tissue is better preferred. And as soon as you cough in or sneeze into a tissue paper, throw it into a dustbin. Do not throw it on road. Do not spit anywhere on the road or outside. When you cough or sneeze into your elbow, because that way you do not transmit the infection to your hands and then transmit to other people by touching objects or by shaking hands with people. So that's the best way to prevent the transmission of infection rather than wearing masks, because that's not recommended. What happens is when you start wearing a mask, you have a kind of a false security that now you are safe, and you do not follow the other measures of prevention. So if there is anything which you suspect, if somebody has been coughing in your house or somebody in close contact, and if you develop cough and cold or a fever, please see your family physician immediately.